You're watching State of Texas in Depth on KXAN News.
Good morning and thank you for joining us for State of Texas in Depth. I'm Josh Hinkle. The clock is ticking, just a little more than 24 hours to enroll for health insurance through the marketplace exchanges set up through the Affordable Care Act. This week, President Obama's administration announced they would extend the Monday deadline for anyone who at least started the enrollment process, all to get the most amount of people to enroll. On Thursday, the administration reached a milestone. 6 million people bought health insurance through the exchange. Republicans like Governor Rick Perry blasted the deadline decision. In a statement, he said, whether it's deadlines or red lines, it's clear we can't trust President Obama to back up what he says. The challenge in Texas has been our large uninsured population. Among big states, Texas has the highest uninsured rate, 33%. That's a 4.8 million adults without insurance. In the most recent report from the federal government earlier this month, about 295,000 people in Texas have enrolled through the marketplace exchange. With the rush to cover Texans, one group put in extra hours. The Latino Healthcare Forum stayed open from Thursday morning until Friday night for an enroll-a-thon, specifically targeting the Hispanic community. The goal was to reach people no matter when they were free.
Some of the cultural barriers, obviously the language is one thing. There's still a digital divide with Latinos, so a lot of the folks don't even have email accounts, so we're helping them set those up too, so we can automate the process.
Nearly a third of Hispanics under the age of 65 in the U.S. don't have health insurance. Since its inception, Republican leaders in Texas have opposed President Obama's key legislative work. When the Supreme Court ruled that states have the choice whether they start their own health exchange or expand Medicaid, Texas chose not to. By not expanding Medicaid, some uninsured in Texas fell into a difficult position where they made too little to qualify for federal insurance subsidies, but too much to qualify for insurance through Medicaid. At the time, Governor Perry said expanding Medicaid would cost the state too much money, even though much of the cost is passed along to the federal government. The issue of Medicaid could play out in the race for governor. This week, during a campaign stop in Austin, Democrat Wendy Davis was asked about expanding Medicaid in the state.
There are some pros and cons, obviously, with the Affordable Care Act, but I do want to see Medicaid expansion in Texas. Texas stands to gain over $100 billion in the next 10-year period of time. If we don't draw down our own $100 billion of tax money that we have paid to the federal level, we will be subsidizing health care elsewhere.
Davis said expanding Medicaid would create about 300,000 jobs in Texas per year. Attorney General Greg Abbott led Texas' legal fight against the Affordable Care Act, suing multiple provisions. He opposes expanding Medicaid because even as Medicaid enrollment increased in the last 15 years, Texas' uninsured rate remained the same. In his published position, Abbott said it is important to recognize that health insurance and Medicaid are not the only forms of access to health care. Charitable care, for example, accounts for a large proportion of persons treated in Texas. There is no one-size-fits-all approach to access to health care. Texas has been front and center in the federal government's campaign to get people enrolled in health insurance. Health and Human Services Secretary Kathleen Sebelius visited Austin on Friday. Our Shannon Wolfson sat down with the secretary.
A big issue in our state governor's race right now is the expansion of Medicaid. So talk to me a little bit about that and your support of it.
This is a generous offer of the federal government, 100% of the costs for the first 3 years. Gradually, they'll pay 90% of the share, and that those costs right now are being picked up by my taxpayers, so we could divert some of the money we're spending on uncompensated care and use it for economic development, use it for education, have services for people who need them. A return on investment, as your mayors would tell you, that is very, very powerful. We're hoping that that conversation continues here in Texas.
You can see that full interview posted on KXAN.com. Turning to another issue affecting health care this week, a federal appeals court upheld Texas' new abortion restrictions. The law limited how, when, and where a woman can receive an abortion, as well as who can perform the procedure. On Thursday, a panel of judges in the Fifth Circuit overturned a lower court's decision that the rules had no medical purpose and violated the Constitution. Since the rules started taking effect, more than a dozen abortion clinics have closed. Judges in Thursday's ruling said on the face, the rules do not appear to impose an undue burden on the life and health of a woman. Governor Perry praised the decision, saying the people of Texas spoke through their elected leaders and that this was good news for women and the unborn. While the ACLU said the ruling was disappointing because women living in rural and poor areas will be harmed by the politically motivated law. One major concern was that the law would force clinics to close in most of the state. Interestingly, Planned Parenthood says it plans to open a new clinic in San Antonio that will meet the stricter standards. The organization says it has raised about half of the $5 million it needs to build clinics. Finally, some good news on the health front. Many counties in our area are on the healthier side. The University of Wisconsin released its county health rankings, finding Williamson, Travis, and Hayes County among the top 10 healthiest in the state. Every other county in our viewing area were in the top 50%. In Williamson County, the second healthiest in Texas, access to care and healthy options are easy for the young and experienced alike.
They have golf and any kind of exercise you would want, and the pools to walk, to swim. We eat healthy.
People realize they have to increase their activity level. You know you need to if you want to enjoy what else you've got left in life. And I think that's what a lot of people here are doing.
There were some negative aspects to our health, namely long commutes and some lifestyle choices like alcohol consumption. Still to come on State of Texas in Depth, as the state tries to handle its healthcare challenges, these may be the leading voices. Democratic candidate for Lieutenant Governor Leticia Vandepute, a pharmacist, and Republican State Representative John Zerwas, a doctor. Next.